Welcome to Peer2Peer, the podcast, brought to you by Rayne. Listen in as we hear from top surgeons having great conversations with their peers about hot and popular topics in ophthalmology. Today we are speaking with Dr. Eric Donnenfeld and Dr. Jerry Hu from the United States. Dr. Eric Donnenfeld is an internationally recognised expert and pioneer in refractive, cornea and cataract surgery, and one of the leading refractive and cataract surgeons in the United States. Dr. Jerry Hu is a leading private practitioner in the United States with a large interest in academic and research endeavours. He has extensive experience in the treatment of glaucoma, diabetic retinopathy, dry eyes and other ocular diseases. Thank you both for joining us today to talk about your RayOne EMV billing packages in the United States. Let's jump right in. What does your RayOne EMV billing package look like? Do you charge for any additional services in tandem with RayOne EMV? Dr. Donnenfeld, why don't you go first?
So the EMV lens is considered a normal non-premium lens by CMS in the United States. So you can't bill directly for the EMV lens. When they come out with the toric lens, then of course you'll be able to bill for that. But for the present time, we have created a refractive package. The refractive package is a limbal relaxing incision for pre-existing astigmatism. It is completely reasonable to charge patients for a limbal relaxing incision, and I charge patients $700 for my limbal relaxing incision package to improve their vision. Now, I can implant any lens into the eye at that point. I choose to implant the EMV lens by Rayne because I believe this gives the patient the most benefit. The lens gives an additional amount of near commensurate with probably better than the Vivity in my experience, and certainly better than the Eyhance lens. And by giving patients the LRI and the EMV lens, it creates a premium package where they can achieve good distance vision and good intermediate vision. And very commonly, I'll do the non-dominant eye with a little bit of mini monovision of about a minus 0.75 to minus 1. And now the patient becomes relatively spectacle independent for most intermediate and near tasks, thanks to the extra reading aid of the extended depth of focus characteristics of the Rayne EMV lens. Having said all this, I want to be very clear. I'm not charging anyone anything for the EMV lens. That is part of the package that's included with the limbal relaxing incision. It would not be legal for me to bill for the EMV lens as things stand today, but I feel that this offers patients a premium outcome on their vision with the added reading associated with the EMV that just makes the patients happy with their post-operative results.
Thank you very much for that very detailed response. Dr. Hu.
So we have three basic implant packages. One is what I call precise vision package. That would include a femtosecond laser and an aura intraoperative aberrometry laser, okay, combined with an improved lens implant, okay. And the second package is the smart vision package, and that's where EMV comes in. The smart vision package includes a aura, intraoperative wavefront aberrometry with an improved implant choice. That's the EMV. I use EMV, those are the monofocal plus implants, is that I stay within the regulation, the realm of the approval. And so I basically say, hey, smart vision, we can use intraoperative wavefront aberrometry to offer you monovision or to help us to correct your astigmatism. Okay, so it's either one or two. Therefore, I use aura, combined with EMV to give patients monovision. It has to be monovision, and therefore it's a presbyopia correcting approach. In that case, we can charge. Okay, so I tell them I'm really charging them for the approach, for our expertise, for the aura, and then the implant is just in the package for free. So I don't tell them, I don't advocate that I'm charging them for the implant. So that's the key difference.
Thank you. Why do you offer the RayOne EMV as part of your refractive package?
My lens of choice for the refractive package in my practice is the EMV lens, because I fully believe this lens gives patients the most value. It gives them quality distance and quality intermediate, and also is a perfect lens for doing mini monovision. At the same time, that's not the reason why I am charging patients for their premium package. I'm charging them only for the lumbar relaxing incision, which is the safe harbor for billing patients directly for a cosmetic aspect of their surgery, which is the treatment of astigmatism.
And have you found that the RayOne EMV provides the same quality of vision as a standard monofocal?
I have not had any patients complain to me about, having decreased quality of vision. Okay, and also by looking at my own spreadsheet, of all my the patients that we have performed, they all have great distance vision. And I have not had any patients who pointedly complain that they notice the quality of vision being compromised, with any of the monofocal plus lenses, EMV or some of the other models. So I have not seen that at all. The patients are very happy.
One of the concerns that clinicians have is that when they place a lens that provides additional reading, that the patients lose quality of vision at distance. Do they lose contrast sensitivity? Do they have glare and halo? And I can say unambiguously in my postoperative management of my patients who've received the Rayner EMV lens, I have not seen an increased incidence of glare and halo. The patients have tolerated the lens very well, and essentially has all of the visual characteristics of a conventional monofocal lens, but the extra value of the extended depth of focus technology. So this lens has become a very important lens in my practice because it gives patients that extra value without degrading their vision at distance.
Thank you. And thank you both for your time and for joining us today. Stay tuned for the next episode of Peer2Peer the podcast with host Mr. Alon Barsam as he leads a conversation with his colleagues at OCL Vision about marketing your clinic in the digital world. See you then. For more information about this episode's topic and to read the show notes, visit the Peer2Peer hub at rayner.com/peer-to-peer. This podcast is provided for general information purposes only. The presenters' views are their own. Rayner does not endorse off-label use. Users must refer to the product labelling and instructions for use for Rayner products in all cases. Not all Rayner products are available in all countries. The full disclaimer can be found in the show notes.